sauti, ukikimbia na kucheza, mawingu yanafutika.
Good afternoon, everyone.
Kama maji ya ziwa, furaha inakujia.
Thank you for dialing in. We'll request a bit of time, maybe 3 minutes, to allow the rest to dial in. After which my co-moderator, Judith Atieno, will be able to take us through. Sorry for that, and looking forward to this wonderful discussion today.
Mchezo ni furaha, mchezo ni dawa. Kimbia na ndoto zako, usichoke wala kuwa. Mwili wako ni gari, akili ni ramani. Safari ya maisha lazima iwe safi. Twende sasa, tusonge mbele. Nguvu zetu zishinde vikwazo. Fanya mabadiliko, leo ni siku yako. Jipe moyo, tembea kwa mwanga. Mchezo ni furaha, mchezo ni dawa. Kimbia na ndoto zako, usichoke wala kuwa. Mwili
Good afternoon, everyone. Thank you for your patience. Allow me to welcome Judith Atieno to take us through. Over to you, Judith.
Thank you so much, Collins, and thank you everyone for plugging in this afternoon for the Pre-Sports Wellness Summit. As you can see in your screens, we are training champions of the future, mental health, performance, and social awareness. So, karibuni sana, welcome sana, and sabaonani this afternoon. Distinguished delegates, esteemed partners from the multilateral sector, and community practitioners across the continent. Good afternoon and a warm welcome. My name is Judith Atieno, and we are convened here today for more than a digital dialogue. We are here to participate in a catalytic intervention focused on the psychological human capital of the African youth. And what a way to commemorate Mental Health Awareness Month. As we are all aware, May is Mental Awareness Month. So as you're browsing this afternoon and the rest of the day, please keep in mind that we are championing for the mental health awareness within our circles and within our communities. So as you observe this Mental Awareness Month, we recognize that our youth are not merely athletic prospects. They are the architects of Africa's future. And in line, we have a series of seasoned professionals ready to delve in to discuss and talk more about sports and integrating mental wellness into sports. So as we proceed, I'd like for us to be ready with our phones and our browsers. And please note that this session is being recorded for technical synthesis and longitudinal learning. We are also documenting the session through digital captures for our safe spots, advocacy reporting, and by remaining in this space, you provide your mandatory consent to be part of this institutional record. So I just put a pause for members to react to this consent. I will repeat the consent, and if you agree, you can just do me a thumbs up to be able to agree. So please be advised that this session is being recorded for technical synthesis and longitudinal learning. We're also documenting the session through digital captures for our safe spots advocacy reporting. And by remaining in this space, you provide your mandatory consent to be part of this institutional record. You can do me a thumbs up again. Perfect. On to our next icebreaker. I would want us, as you can be able to see in our screens, we have we want to activate our socials. We want to do a small thing, given that we are talking about digital mental wellness with sports. We are young people, we are active people, we are on social media, we are on digital platforms, and I'd like for us to trend and I'd like for us to be active and commemorate. Given that it's the 7th of May, we are just kickstarting our mental awareness month, and I would like us to get into our phones or our browsers and log into our websites, the Youth Initiative Development Program on LinkedIn, on Instagram, on Twitter, and I'd like for us to use the hashtag MindballAfrica. If Calvin, you could please put the hashtags there so that people can be able to tag along. We have hashtag MindballAfrica and hashtag Nurturing Champions. We have hashtag YIDP. So you can see below the hashtags, we have hashtag MindballAfrica. Please do me a thumbs up if you're able to see and if you've been able to log into our LinkedIn profile before we proceed. Hashtag MindballAfrica, hashtag Safe Sports Charter, hashtag YIDP, hashtag SWS 2026. Please remember our theme for the day is nurturing resilience in the African arena, where we want to talk about sports and integrating sports wellness into psychological advancement. So if you're able to tweet, if you're able to share within our LinkedIn, you'll be able to see our profile there. You'll be able to see the engagement that we've done. Please type something. What does mental health and sports mean to you? How can you integrate sports wellness? How can you be able to champion? And in what ways are you championing for mental health within your sports activities? I know all of us here are young at heart, young at mind, and young physically, and we are all engaging in sports in one way or another. So you can please share, and don't forget to hashtag MindballAfrica, hashtag Nurturing Champions, hashtag YIDP, hashtag SWS. Catch us on our social media platforms, LinkedIn, at Youth Initiative Development Program. So we can do a thumbs up if we're there so that we can proceed. If we are together. Perfect. 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 Thank you. So without wasting so much time, we are 10 minutes past 2. And thank you so much once again for finding and creating time this afternoon to plug in, to join us during this roundtable discussion where we'll be having enormous discussions and we'll be sharing with one another. What does sports mean to us? What does mental health mean to us? And definitely we'll also be able to share with you what we are doing as Youth Initiative Development Program to advance sports, and mental wellness digitally. So to lead us into the next technical heart of this session, I am honored to introduce a man who represents the perfect synergy of field-based implementation and strategic vision. He is a man we all know or we have interacted with, and he has spent years hosting tournaments, supporting schools, and building social infrastructure where it was absent. This is a man that is very common in the hearts of Nairobi, Kenya, in the hearts of our settlements within Nairobi, a man who thrives in social infrastructure development, a man who thrives in digital infrastructure, more so especially within the mental health space. Please, together with the rest of the team members, allow me welcome our CEO of the Youth Initiative Development Program, Mr. Collins Dundo. Karibu sana, Mr. Collins, and we'd love to hear more from you. Meanwhile, don't forget to tweet, don't forget to tag. If you have any questions, please chat us below, chat us on the chat box. The chat box is open and we'll be able to assist each and every one of you. Thank you, and karibu sana, Mr. Collins.
Thank you so much, Judith, for that high-octane introduction. You've set the pace, and now it's time to play the game at a different level. So ladies and gentlemen, you can see I have my cup of water. So if you have a cup of somewhere you can get a cup of water, please do, because today's discussion is very key, and we'll be having a bit of activities as we do have this conversation. So jambo sanibo nani, that was a word that I was taught, but I've forgotten. But anyway, jambo sana, good afternoon, everyone. Good morning, good evening, from wherever you are joining us from. And a massive welcome to over 30 global stakeholders join in this digital century. Like my colleague have said, my name is Collins Dundo, and I'm the CEO for Youth Initiative Development Program. And as I look at the name in the chat, I see more than just delegates, and I've seen people who have been taking their time, burying their head in the field, in the community, in policy, people who have been so much engaged across Africa. And I would like, before I say another word, I would like to ask everyone, I want everyone to go to the chat box right now. And on a scale of 1 to 10, where 1 is toxic and 10 is a sanctuary, how mentally safe is the sports environment for the children in your community? Give me your honest numbers. Let's see the real scoreboard of the African mind. If you are a coach, if you are a philanthropist, if you are a parent, just tell us how the environment looks like. If from a scale of 1 to 10, 1 is toxic and 10 is sanctuary. Let's put our chat active. I want to see that in our chat. Thank you. So we know today we are in the mood of Mental Health Awareness Month, and we are not just here to have a conversation or to talk. We are here for a revolution. Take out your phone, like my colleague have said. Please, let's make this conversation trend. Let's tag YIDP. Let's do something. Post. I can give you a suggestion. If you can post, Africa is moving from play to protection. That will be very, very wonderful. Africa is moving from play to protection. So distinguished guests, let us begin with some radical transparency. This roundtable is a non-funded and volunteer-led initiative powered by Youth Initiative Development Program in a strategic partnership with the III Foundation. We did not wait for intentional grant cycle. Why? because the urgency of the performance well-being paradox in Africa requires immediate leadership, and that's what we are doing today. And I would like to ask another question. Ask yourself, why are we waiting for a Western grant to save an African child's mind? If we truly believe our youth are our greatest asset, why is mental health still the last item on our sports budget? Think about that, and maybe you can respond on the chat. In my years on the field, from the dusty pitches to school athletics department, I have witnessed the invisible injury. Being a young man who could wake up very early in the morning, I think I was one of the first people who used YouTube, leave alone Yego. I could go to the Nyayo Stadium, I subscribe, I watch YouTube, and I do my long jump, something that I knew one day will put food on my table. Unfortunately, I did not make it. But I don't know how many millions of young people went through what I went through. But I thank God because I had something that the fallback plan, because I graduated and I had my course, and that's what I am surviving on. But there is a lot of talent that are wasted, and our young talented people keep on being depressed, and some getting into drugs and substance abuse. In Africa, we have turned sports into survival strategy, and we see a 12 years old and we don't see a child. We see a socio-economic exit strategy for an entire family. Here is a thought-provoking scenario. If you are a star athlete in this virtual room today, the one you are banking on for a pro contract suffers a career-ending injury this afternoon. What is left of their life by tomorrow morning? Have we trained a champion, or have we created a refugee of success who has no identity outside a jersey? Think about that. So over the time that we have been in the field, we have managed to identify so many gaps within our sports sector. As an organization, we've narrowed them down into two for the interest of time. And the first that I would want to mention is the dual pressure dilemma, compounded stress of academic rigor and athletic performance. We have the infrastructure of silence. According to WHO, Afro 2023 data confirms less than 15% of African schools have a mental health protocol. And we are talking about sports club. How many grassroots sports clubs do we have across Africa? These sports clubs do not have. It is near total void. It is close to zero. If you are having these policies, please feel free and at least put it on a chat. We'll be more than glad to reach out and find out how you are doing it. So in the chat box, in your experience, what is the biggest reason coaches stay silent about mental health? Is it lack of knowledge, fear of being seen as soft, or stigma? I will want you to put that on the chat. And I know we'll be able to have this discussion, and today we come up with a solution because we are the solution. So as YIDP, this is not just, we are not just here to complain, but we are here to curate. And that's why we've managed to reach out to various experts. We are responding with a curative pedagogical framework called Mindball. I know some of you may have interacted with the material, and we've reached out to a couple of even experts to review the book and give us their feedback. Mindball integrates cognitive behavioral resilience directly into sports drill. Our curative design team is currently finalizing the Mindball technical toolkits, parental guide. These resources are in the review stage, designed to empower every coach to serve as a frontline mental health responder. So can we really call ourselves coaches if we only train the legs and ignore the brain that moves them? Are we building athletes or are we just using them? Think about that, and it's a $1 question, a $1 billion question that you can have time and internalize it, and you can also feel free to post that on the chat. Before we transition, let us practice what we preach. I will invite all of us, over 30 people, to engage in 60-second somatic reset. I hope if you can see me, I would like to see a thumbs up. Let's make this discussion as engaging as possible. And my colleague will be able to drop the presentation on the screen. Okay, are you able to see me? Okay, just stop that on the screen kindly. All right, so we are not going to do much for the interest of time, but I want us to do something very common, but very useful. Very common and very useful. Kindly mute yourself. So adjust your posture a little bit, because I know you've had a long day. Posture a little bit. Just drop your shoulder. Release tension in your jaw. And now let us take a deep diaphragmatic breath in and hold and release. Let's go in. Release through your mouth. Slowly. Breathe in deep. Release slowly through your mouth. Thank you so much. For the interest of time, allow me to go ahead. But our screen will remain as it is. The technical team, kindly, you can spotlight the speakers, because I'm yet to introduce the wonderful keynote speakers and the panelists that we have today. So even in high-level strategic dialogue, kindly, well-being is a priority. If you are in an office, kindly introduce stretching, introduce those breathings, will be very useful for your team mental well-being. So to expand on this vision of social... Kindly, who is that? Technical team, please mute that person. Okay, to expand on this vision of social infrastructure, I invite a lady who is a titan in the global mental health space. She is the president of the ISSUP-Kenya chapter. I can see the energy on her face. A scholar of the mind and a restless advocate for substance use prevention and psychological safety. She understands that to save the athlete, we must first save the child, which is very key. Ladies and gentlemen, allow me to welcome our keynote speaker, Dr. Pamela Kaithuru. Doc, take us across the bridge to resilience. Over to you, Dr.
Well, a good afternoon to us all. Good afternoon, participants. Good afternoon, fellow sportsmen and women. I believe we are here because sports for us matters, and we value this, especially for our continent. I want to make this statement briefly and in a way that really I hope it can enhance the dialogue, even as we think about the bridge to resilience, so that we can reimagine the African sports together. And more so, looking at it from a public health perspective, so that we can make our fields, our places of building athletes, as sanctuaries that can be able to give us the best for the country, the best for our families, the best for the athletes themselves, because this is business. This is a livelihood that we need to rethink how it can be done differently for posterity. So my name is Pamela Kaiduru. I am the President, International Society of Substance Use Prevention Professionals, Kenya chapter. We have 39 chapters globally. Am I being heard? Is there noise at the background? Then I can move. Can you confirm for me, please? Am I being heard?
Yes, you are.
Okay.
Go ahead, kindly.
Yeah, it's because I'm in another meeting and there's some background noise. I was fearing it is interfering. Let me make this brief statement. First of all, acknowledging the colleagues that are here, the partners, the sportsmen, the coaches, the people interested in this space of sports for Africa. And to say that it is a very great honor for the ISSUP to be part of this important growth in the sports, whereby we are an organization that is mandated to enhance prevention, treatment, and management of health and well-being, especially around substance use, harm reduction. So it's a big pleasure for ISSUP today to be part of this. And when you invited us, Dudo, to be able to be part of this reimagining or thinking about something very powerful that will affect the individuals, will affect the sports fraternity, that will actually affect our nations. We are looking at it as not like a new invention as it were, but looking at it as a space that as African sportsmen and women, we can change or retweak the arena of sports so that we can be able to have a fraternity that is birthing sportsmen that are going to impact the society, that are going to really take what they do seriously and in a way that they are healthy, in a way that they are contributing to sustainable development. Why do I speak like so? Is knowing that most of our sports people hail from dusty village pitches to the level that they become elite professionals, to get to the elite training centers, to compete in Africa, to compete globally. So sports for us as Africa is not only a sport, but it is an identity. It is a hope. It is an aspiration. It is where the African child first learns discipline, because sportsmen are disciplined people. When our young people resort to sports, that is where they learn discipline. That is where they learn teamwork. That is why where their dreams are. Some of them begin. That is where some of the dreams are shaped. That is where some of them are imagined, and they are able to mature to the big horizon. I heard our director there, Dudo, speaking about his own story, where he began, and it represents the African child in terms of sports. But the biggest question I ask myself is, are the spaces where our sportsmen and women being built, where the young people are being built, are they nurturing them, or are they causing them to really lose it out? And that is where there is the hidden gap from being a child to being a champion. So across the continent, talent for us is abundant in terms of talented African children, but then the pathway needs to be promising so that it can be able to help them to perform in a very fragile environment. Too many of the athletes navigate very challenging situations where even the mental health issues that they go through are not being addressed. The pressure to perform, the pressure to shine, the pressure to bring medals, the pressure that they encounter amongst their peers. They are also faced with pure nutrition, because many of them are coming from marginalized community. Many of them are coming from livelihoods that are not really stable. So they have nutritional challenge. They also have physical strain that they are faced with. Unfortunately, our spaces of practice at times have challenges of substance use. That is where some of them are introduced to substance use, to the risk of doping, and therefore losing out on their talents. There is lack of structure in terms of mentorships and life skills. So this gap potentially would make some of them get lost along the way, and some of them also get exploited. And that makes it very important for us as a people to think, what is it?
Dr. We have lost you. You are on mute. You are on mute currently.
Now you can hear me?
Yes, please go ahead.
So then, how can we make our arenas to be better performing spaces where public health or the health of the people is really being addressed? How can we make our training grounds at the local level, at the school level, at the public space to become safer for our people? This is the approach that we can be able to use, ensure that there is mental resilience alongside the physical training. Nutrition is being addressed in terms of, are they aware of what they should be able to eat, or is it even provided? How can we embed sports culture not only as an afterthought, but strategically think, what does it mean? Look at it from a business perspective. Look at it from a sustainable development perspective. Not only focusing on the sportsmen alone, but also focusing on the coaches, the trainers, the people who protect our athletes, and those who are mentoring them. So we need to look at wellness, health and well-being from an holistic perspective. So somebody may be asking themselves, so what? What does this mean? It means we have to build bridges, just like the title was. And I look at these bridges from a 3-pillar perspective or 3-pillar approach, whereby intentionally we have to have community development organizations like YIDP and others to influence sports from a point of understanding, from a point of lived realities of our young people, so that the socio-economic pressures, the vulnerabilities, the cultural context is put in context, and then our people are empowered. We need to, as communities at the lowest level of bringing up these athletes, we need to integrate mental health literacy amongst the youth. We need to deliver community-based substance use prevention strategies. We need to engage with the guardians and the parents of our sportsmen and sportswomen. That is at the community level. That is at the grassroots level. Schools are also points of growing our sportsmen. So at school, early platform of protection need to be our concern. Are the athletes and encountering proper systems at the school level, so that then they can be able to grow as people who are healthy physically, healthy emotionally, healthy intellectually, healthy spiritually, looking at our athletes holistically. And as I said, it has to be intentional. We have to have early identification of mental health challenges at the school level. As the sports teacher, can you be able to pick a distressed player? Can you be able to pick a distressed young person and refer for support or encourage them without rebuking them, without looking at only the skills of playing? Can we use those points as areas of growing their life skills so that they can have emotional regulation, so that they can have ability to make decisions, so that they can be able to navigate around the developmental stages of adolescence and, of course, young adulthood, so that we have people who are not falling through the cracks of peer pressure. So the schools become sanctuaries for early detection of any substance use patterns or any risk behaviors that would actually compromise. The sports clinics or the fields and the setups where the athletes meet, to some extent we will call them clinics, but one from an African perspective and a Kenyan perspective, you may not see it from a clinic perspective, but where they meet in those sports ground, where they go for trainings, let's refer those places as clinics. They may not be as elite as they ought to, but they are places where health and well-being should be thought about. And as I said, we need to provide them evidence-based guidance and injury prevention and recovery. You see, within the clinics, as they are practicing, as they are being grown, they should be able to identify injury, not only physical injury, but also emotional injury, that it can be addressed so that we have a holistic person. As we help establish strong anti-doping systems, we also need to establish systems that will be drug demand reduction systems within our clinics. We need to train our coaches on psychological support and ethical leadership. Ethical leadership goes beyond the moral perspective to the point of putting in the values, but also putting in the strength that these young persons need. Then we ask ourselves, who will do this? Who will contribute what? What is the role of some of the players in this space? And I want to look at maybe 3 very significant players in the space of sportsmen or sports space. The role of the coaches. The coaches play a very important part, but the most underrated aspect of the coach is the public health aspect. Where do we place in the public health workforce within the coaching fraternity? So the coaches need to be able to influence our athletes, to recognize the signs of distress, to recognize the risks, to address the mental health issues. And we know that our coaches maybe are not trained in these skills, but we have a responsibility as professionals, psychologists, public health experts, to ensure that we professionalize and go beyond tactic and technique to a point of, in this century, ensuring that our coaches are trauma-informed, our coaches have prevention strategies, our coaches have mental health awareness, our coaches are ethically grounded, so that then they can be able to help us build and shape human beings' abilities that will actually be productive. Where does the family come in? The guardians, the sources where these children are coming from. That is another level of responsibility, so that they don't push our children only to perform and bring glory to their families. Can we look at what we are feeding them on, so that we don't have athletes who are malnourished, so that we don't have athletes who are leaving their homes already anxious because the homes is not safe. The places of origin are not safe. The safety of the homes they are coming from, the spaces they are coming from, is the responsibility of the family. And therefore, the family plays a very important key in ensuring that sports is enhanced and our people are, our athletes are growing well. So that we are not having athletes who are coming depressed, anxious, burnout, and yet we expect them to be productive. So the home front becomes very important for nutritional support, for mental health support, for psychological support. And we remember that psychological well-being, or when somebody has distress or any stress, it is not a sign of weakness. It is a point for that we need to be able to look at. Now, the third tier I think about is the professional organizations, the counselors and psychologists organizations. We need to play our part to ensure that prevention occurs, that support and care is given to our people, that they are not being punished for maybe non-performance. We need to enhance dialogue. We have to play a part of education so that we build strong systems that are evidence-based, so that we can train our sportsmen, train the fraternity in the field to ensure that all is well. So what am I saying as a call to action? It is that this is intentional. This has to be done by all of us. We are not leaving it to my friend Dundo there alone and his organization. Everyone has a part to play. The government brings in policies. Partners bring in their various strategic abilities. Individuals put in, the coaches put in, so that then we can have sportsmen that are actually grounded and that can be able to do this from a professional perspective, be able to compete internationally, be able to have value and still live long. It is not that like a sportsman, they have a glory of maybe 10 years, but then the next 30 years of their life is a troubled life. We have to think beyond that. So my call to action is that we have to look at this from a point of being visionary. Governments must have to align sports and public health policies together. We have to develop partners and investments in integrating these programs together. The sportsmen themselves have to, the sports federations themselves have to adopt to safeguarding frameworks. There must be safeguarding frameworks from the sports organizations and the federation. And of course, communities have to reclaim spaces that are healthy for our people to grow. And above all, of course, the youth themselves, the young players, must be able to look at themselves as future champions, not just champions today. So as ISSUP-Kenya, from a professional perspective, we wouldn't want to say that there is hope in growing sports as a service, as a product that is going to influence growth and development. There is hope for families. We need to build resilience at the community level, and of course, look at our sportsmen from a point that we are not just pursuing their greatness while they are getting harmed on a daily basis, but we have to strengthen them, not to exploit them, not to abandon them, not to have them break down, but build bridges to ensure that their journey is seamless, their growth is incremental, and we create sanctuaries that will enable resilience and therefore have sports people that are influencing our nations and sports people that will be able to live long physically, mentally, spiritually, intellectually, and in all aspects of health and well-being. I want to close and encourage us to continue with this dialogue. Thank you.
Thank you so much, Dr. I wanted you to continue, but for the interest of time, I just have to. But thank you for such a wonderful contribution. and you really outlined them so well. Thank you, and thank you. And thank you for setting the pace for today's conversation. So at this point, ladies and gentlemen, just allow me to give Daktari some good clap. So I want to see is clap, 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 clap. Some good claps, emojis. Thank you so much. So that's Dr. Pamela, the president of ISSUP-Kenya chapter. We would like to appreciate you. Your leadership in the 2024 Global Substance Use Prevention Framework has set a standard that we at YIDP hold as our North Star. You reminded us that an athlete's mind is the most valuable territory we must protect, a sanctuary. I think you started by that statement, not just a stadium or just a field. Thank you. Thank you. Ladies
Allow
and
me to
gentlemen,
exit so that I can
yes,
go to another meeting.
yes, please.
Thank you. I beg to exit so that I can go to another meeting.
Yes, please, and but
Thank you.
please come back because we have some few questions for you. As soon as I'm done with the panelists that we have, wonderful panelists that we have here, then I think you'll have finished the meeting. Thank you, Dr.
Thank you.
Ladies and gentlemen, if that what the contribution for Daktari has touched you, I'll want you to tweet it right now. Go to your social media handle because this is a mental health awareness month and we are here to trend for the right reason. Use our hashtag MindballAfrica, YIDP, and Nurturing Champions. I hope you managed to grab enough water. Please continue topping up. Now, let's bring out our giant. These are not just names, and they're the people that are doing wonderful job in their various country, and they are the architect of a new African sporting ecosystem. We have close to 30 minutes to 30 to 40 minutes to have a wonderful dialogue with our panelists, after which the forum will be open for every delegate to be able to contribute or ask questions. So at this juncture, I would like to welcome our panelists. I hope technicians, you've managed to spotlight them. I can see the energy, and I would like to give you a minute each, kindly to introduce yourself, just introduction, what you do, and also after that, I'll be able to take you through some of the wonderful questions that we have set for you so that it may be able to inform policies and also be of influence and also transform the way we do things at our grassroots sports sector. So I'll start by Huge Ngata. Kindly, if you are available, if you are present in this virtual room, I'm more than glad to welcome you. Be ready. And in the room, we also have Elkana Nantua. In the room, we have, of course, we have a wonderful person, Dr. Emmanuel Navarra. In the room, we have a wonderful person, Leon Nyang Odur. And of course, Grassroot Soccer is available in the room. Charmaine Nyakonda, you are doing an amazing job. So I'll start by Huge. Kindly just take a minute to introduce yourself, and then I'll go to Charmaine, then Leon, after which now I will introduce some other two panelists who are available.
Thank you, Collins. Can you hear me?
Yes, loud and clear.
Thank you. Ngando Ngata Ug is my name, a name from Cameroon. I am working with UNESCO at the Regional Office for Eastern Africa. We are based in Nairobi, and we serve a sub-region of 13 countries. So I'm leading the team on social and human sciences in our regional office, and that is the team that is also encompassing matters sport, sport for inclusion, sport for peace, reconciliation, civic engagement, you name them. And at UNESCO, we really leverage and value the importance of sport. And we work in this space from a standard setting framework where we develop international law on sport, anti-doping, physical education, and the like. We support member states in policy making to ensure that they are aligned with those global framework. And we have also some little intervention engaging grassroots or even academic institutions and other stakeholders to ensure that the power of sport is really translating into matters inclusion, sustainability, and peace building. So I will stop here. Thank you. Over.
Thank you so much, Dr. So I'll go to Shaman.
Thank you so much. Hi, everyone, wherever you are. I'm speaking to you currently in Bulawayo, Zimbabwe. My name is Shamaine Nyakonda. I work for an organization called Grassroot Soccer. It's an international adolescent health organization that leverages the power of soccer to equip young people with life-saving information services and mentorship so that they can live healthier lives. Grassroot Soccer was founded in 2002 in Bulawayo, Zimbabwe, by Dr. Tommy Clark, who used to play professionally for a local football team in Zimbabwe called Highlanders. And this came from Dr. Tommy Clark watching his friends dying from AIDS and recognizing that soccer could be a positive force in the community and that they could use this to engage youth around pressing issues and health topics like HIV, like sexual reproductive health and rights, like mental health, and key issues that impact young people. Grassroots Soccer operates across multiple countries in Africa, the US and Scotland as well. So Grassroots Soccer is also a good example of reverse innovation and seeing Africa not only as a place that needs to receive solutions, but also as a place that can be the source of innovation, that can create solutions that can be useful to other countries outside of Africa as well. And as I answer more questions during this discussion, I'll speak more to that as well. And thank you for having me today.
Thank you so much, Shamin. I'll go to a gentleman, Odur Anyang. Kindly introduce yourself.
Hey, Luther, can you hear me?
Yes.
Yeah, my name is Odur Nyang Leon. A digital marketing guy, brand management guy, strength and conditioning coach, a rugby coach, mental health advocate. I am the CEO Project Mindstrong, and I'm also a security strategist. But in this conversation, I'm wearing the hat of a mental health advocate and a rugby coach from DBA Africa. I basically work at an intersection of sport, storytelling, and mental resilience, always using content and community to inspire growth. We at DBA Africa simply stands for Dream, Believe, Achieve. We try to use the power of sport to educate, empower, and unlock opportunity for the youth. So we run grassroots sports initiative that build life skills, confidence, and communities. Yeah, thank you so much for having me. Looking forward to the engagement.
Okay, thank you so much, Odur. Because Huge has dropped because of technicality. I don't know whether you are here. Okay, so we'll just go
Yes,
straight.
I am.
Oh, okay, great. Maybe you can switch on your video so that you can be spotlighted. Odur, you'll also remain, your video should be on, kindly. Thank you so much. Right, technical team, go ahead, please. Is everything set? Okay. So thank you so much, our wonderful panelists. I'll start with you, Huge Ngata. Sorry if I've pronounced your name wrong. Kindly forgive me, but I'll try my best to get it right. So, Huge, your work at UNESCO is legendary, and you are the global guardian on quality physical education, QPE. You've just mentioned that. I've been following you. I've been really admiring what UNESCO is doing. And some of the work that we do as YIDP are so much aligned with your great work. I was looking at the UNESCO Fit for Life State of Sports report, and it is clear you have built the gold standard for social inclusion. Under your leadership, the MINEBS 7 conference in Baku recently solidified the mandate that sports is a fundamental right, not a luxury. And my friend, you sit at the heart of global policy. How can the UNESCO Fit for Life framework be utilized by African member states to bridge the gap between physical education and mental health, specifically by standardizing psychosocial safeguarding as a mandatory requirement for school sports accreditation? Over to you, Huge.
Thank you very much. This is a very topical issue, and thanks for having us in this conversation. Too many superlative. You seems to be very fond of using superlative in different ways. It's flattering, and I will be very fair play in the way you have pronounced my name, and keeping the spirit of sport enthusiasm. I've said it, Ngando Ngata Ug. That's the way it's said. And yeah, from the question, and maybe it's important to guide a bit more the audience vis-a-vis some background element. I've said at some point in my introduction vis-a-vis the work of UNESCO, looking at the standard setting at the global level, supporting policy work, but also creating unifying frameworks that could better accommodate the capacity to harness the power of sport for different development outcomes. Needless to repeat how strategic sport is for different achievements of sustainable development goals. And you also alluded to that, including vis-a-vis the whole aspect of inclusion, peace building, and living together. The keynote speaker even mentioned the economic dimension of it. And we have a marketist as panelists that will certainly speak a bit more. We have an helicopter going around. We have a marketist that will speak a bit more on the really the promotional aspect related to sport. Your question, typically vis-a-vis the Fit for Life, I want to present it as a framework. It's a framework that was designed as we were exiting the whole COVID-19 pandemic to see how to accelerate recovery and to promote inclusion via integration of some critical values in policy making for enhancing well-being, especially among youth around the world. Allow me just to briefly mention some of the key objectives of the Fit for Life initiative. That is about increasing grassroots participation in sport and quality physical education to reduce inactivity and chronic diseases. It's about supporting the development of quality and inclusive sport policies, as I alluded to drive health education and quality outcome that reconcile very well with the aspect of quality physical education I mentioned earlier. The keynote also mentioned a lot of the values embedded in sport, from issues inclusion, from fair play, from team leadership skills, and so on. That's why the Fit for Life is also eager to use values education through sport to empower young people, promote quality, equality, as well as to build social-emotional resilience. The same way as this framework is also about supporting teachers and coaches to deliver quality student-centered sport education curriculum. And lastly, it's more about building evidence to support targeted investment in sports. And here again, we connect with the economic aspect of it. But how do you create a very virtuous cycle where positive detection, nurturing, and investment in sport talent generate employment and create a value change in the economic system. So that's also an element that the Fit for Life framework is intended to accelerate. So through the UNESCO Fit for Life initiative, we really want to provide this strong policy and implementation framework whereby African member states can leverage systematically and integrating physical education, sport, and mental health outcome. This is about bridging the persistent gap between physical education and psychological well-being, especially in school sport. Countries can really see the opportunity through this framework to standardize psychological safeguarding measures and make them kind of mandatory for accreditation in different school programs. With your permission, I will try to unpack a little bit. I know we are limited by time, so I will be trying to be brief. In terms of mentioning some ways this could trigger our conversation, and the keynote speaker already said a lot that I will not want to fully repeat. So one could really be around anchoring physical or psychological safeguarding within the Fit for Life framework. And to do this, we need to remember the Fit for Life really as a framework where it's about inviting member states and different stakeholders in the sport ecosystem to leverage this space for strategic intervention, harnessing the power of sport for physical, mental, and social well-being. How do you use sport to promote inclusion? How do you use sport to value a safer environment? How do you really build evidence-based policy making to support the value chain in the whole sport ecosystem? It's also about ensuring that this framework could be about, for instance, explicitly define mental health and psychological well-being, because we speak about those concepts, and many a time in our context, especially in Africa, you may have a kind of rejection if they said you have some mental health issue. It seems as if it's something that doesn't affect us. So we need to be pedagogical about explaining what it is, how does it manifest itself, especially in the sport ecosystem, so that we can become more aware of some of the issues and start pointing at the fingers to what is not working. It could also be about ensuring that psychological safeguarding is as essential as physical safeguarding, being it for injury prevention or for addressing gender-based violence in sport, among others. We want to explore the opportunity for an assessment and a kind of labeling process whereby you mentioned very much the environment of school. We want to see maybe where no school program is compliant unless it demonstrates psychological safety standards. The same could be extended to community and even to grassroots level. We want to see really the interest and the conversation toward developing continental standard for psychological safeguarding in school sports. How do we have harmonized standard across Africa? There are some that exist, but how do we really revisit them, leveraging on different conversation, including the one we are having right now, where we are unpacking a bit more, but building the foundation also on the ecosystem that is already there. You have some safeguarding measures that UNESCO is developing. You have some from WHO, from UNICEF. You have a lot of sport entities that also develop some, and even development partners. If I mention GIZ, they have a very robust infrastructure for safeguarding in sport. How do we really borrow from them to see what will be applicable in different contexts, being it in a university, to create the safer environment protocol we want to see, to ensure that being university, school, we address issues anti-bullying, anti-harassment. We have had an intervention with Aga Khan University last year that was in the framework of the International University Sports Day, 20th of September. And in that conversation, we tried to unpack the findings of an interesting report that was commissioned and released last year in June by Aga Khan University. And that spot was, that report was really about addressing issues, sexual and gender-based violence against women in sport. And it was showcasing the prevalence, impact, and scale of GBV in sport in Africa. It was zooming into countries, Kenya, Uganda, Tanzania. I'm mentioning it because those are elements that will really unveil the trouble some of the athletes are going through, including in a space which is supposed to be the safer for them to evolve, for them to develop their talent and to emerge as elite sports athletes. But because of the lack of policy or poor application of the same, they are exposed to untold atrocities, and that invite some mental health issues in the way they perform, not just in the discipline of sport, but even in their different academic subjects. So we need to be a bit more deliberate in thinking that process through. We want to really strengthen some of this safeguarding. And from that report, we saw really much the need to have a kind of assessment of those academic institutions, schools, where sport is practiced every day, but how much do they have of safeguarding policies? And when they have, are they, those who are supposed to be protected by those policies, are they even aware of them? And so on and so forth. So that would be an interesting conversation to really follow, and that could go even beyond, because we have a grassroots sports engagement where sport coaches, facilitators, some with not with the right skills that will preempt them their capacity to gather and engage with youngsters. They're out there, they are doing different things. Some very good, but also some creating more harm than a positive outcome in the work they are doing. So that's why it's really important to see how some of these spaces, and that's why I even value the conversation we are having, so much so that we develop these standards, we see how to apply them in different environments, and we also think the intersectionality in all of this, and that was also alluded to by the keynote, whereby when speaking about sport, it's not just a matter for the sport or the athletes. How do you integrate the health dimension? How do you integrate the labor dimension? Because sport or particular disciplines, these are professionals also, and they earn a living out of it. How do you harness the economic value related thereto? How do you really see the cascading effect of investment in sport for social well-being, and so on and so forth? So much so that speaking about sport, you think health, you think even culture, because there also you see traditional sports and games and the need to really leverage them and to also safeguard them to ensure that it's not a space where you will have issues related to discrimination, stigma, GBV, doping, and everything that we heard about from the keynote speaker. I want to insist also on the capacity building that is needed for the ecosystem to thrive, where we create a reasonable and really impactful accreditation mechanism and continuous training mechanism to ensure that those professional or non-professional are equipped with the competencies that will allow them to really do their work in a very ethical and professional way. We also need to be more deliberate in integrating, strengthening, and monitoring, safeguarding into the curriculum, as I was saying, so much so that this ecosystem is strengthened. I mentioned, alluding to the report from Aga Khan University, the study they did, and we need really more of that because you cannot assess the effectiveness of safeguarding if you don't monitor it, if you don't collect the data that will speak the reality of what it is, the mental health or well-being reality out there. How do you gather all those information? Engaging with students, engaging with the community, engaging with coaches, and so on. How do you secure spaces, safe spaces where some of the incidents that could arise could be easily and safely reported and attended to, and also how do we ensure that physical education participation rate is increased rather than decreased, because you will realize some people will even shy away from practicing sport because they will say when they are in sport attire they look this and that. Because they did a poor performance and the kind of reaction in the social media was in such a way that they will not dare going back in a field because they are afraid of a failure again, and so on and so forth. So yeah, these are just few thoughts, and I believe we have opportunity to discuss. We have opportunity to think of mechanism that will ensure a more holistic coordination, bridging physical education and mental health, having a very clear multi-stakeholders engagement approach where from ministries to civil society organization and other entities are well involved. And maybe lastly, I want to highlight here what we have also as a mechanism to look into some of those aspects, what we call UNESCO chairs. We recently established at the Kenyatta University here in Kenya a UNESCO chair in inclusive and sustainable physical education and sport for community development. And it's really trying to look into aspect enhancing community health, social inclusion, and capacity building through sports. And that connects also very well to the conversation we are having, and I will really look forward to the opportunity to keep this conversation on and to see effective spaces for engagement, so much so that the potential offered by some of these conversations translate into also a concrete intervention on the ground moving forward. I want to stop here and thank you for again giving us this space where we want to see that Africa's sporting future depends on how we we nurture the athlete at the grassroots level in school, in communities, and so much so that sport is an investment. We saw in Botswana hosting this global competition, athletic competition, and how beautifully it was organized. We want to see something similar in every single African country, and ensuring that safeguarding of international competition is secured, that issue mental health will not affect the different participants and so on. And yeah, let me stop here.
Thank you so much, Ms. Ngata. That is so wonderful, and that resonates so well with the conversation that we are having here today. And in fact, we have series of this dialogue. This is the first one. We'll have the second one, which gonna be on 14, which will be purely on PPP partnership, and then the third one will be youth-oriented. Even the athletes themselves should come across the ball. And you mentioned something so important on culture. Sports culture is very key. So we'll have athletes across the globe sharing how well sports within their community. Thank you so much, and please don't drop. We have some good questions for you from the audience, and I believe this gonna be fire. I can see Shaman Yokanda is so charged, and Odur Leon also is very charged on the other side. So ladies and gentlemen, allow me now to move to the next bit, because I want this to be as engaging, this conversation to be engaging. I'm not seeing a lot happening on the chat, but please, let's test the reality on the ground. In the chat box, please, does your local school or sports club currently have a written mental health policy? Type yes if you are yes or no. I know we have coaches, we have those who are working with clubs, we have those who are working with schools. Please feel free to chat or to put that on the chat. Let's see the accreditation gaps in real time. So Ms. Ngata, you've given us the global blueprint and what you are doing and the what. But a blueprint to work in Africa, we need regional political will. We need a bridge between nations. And that brings me to our next speaker. Ladies and gentlemen, allow me to introduce, I was supposed to introduce my colleague Elkanah Nandwa from the East Africa community, but listen to this. During the time that we engaged with him, this is a testament to why we are here. As we speak, Elkanah has been called for a duty, so she was not able to join this call. They are literally drafting something regional on mental health policies. And while while the chair on the Zoom is empty, his work is in the room. He sent me a note saying, Collins, tell the delegates the ESC is no longer just watching. They are legislating. That is the ego of Africa rising, yes? So he is on the front line of regional resilience, harmonizing how we care for mind across East Africa. We wish success in that boardroom, because his win gonna be our win as well. So wait, I see the chat moving, and if you are a coach on this pitch today, on this call today, on this discussion, I want you to type, I am a responder. If you are a coach and you are here, please type, I am a responder in the chat, because there's a lot that have been mentioned that coaches, the capacity for coaches really needs to be built. And that will allow us to know that you are alert and you are ready for this. Let's see it. And don't forget to hit that share buttons on our social handle. And also share something, use Safe Sports Charter. Let the world know that in this Mental Health Awareness Month, Africa is not just talking, we are harmonizing, because there's a lot that have been mentioned with Mr. Ngata on a lot happening, and also developing continental standards, as well as revisiting that what we already have. And of course, there is a wonderful framework that I strongly believe let's also familiarize ourselves with it after this call. Again, I'm gonna go to as colleague, that is Dr. Emmanuel Navarra, the CEO and the principal investigator at HHCSI. Emmanuel is the clinical shield of humanitarian health in West Africa. His 2023 and 2024 research in northern Nigeria on community-based HPSS is literally saving lives in conflict zone. So now Dr. Emmanuel is currently navigating medical emergency response. That is the life of principal investigator, but I've spent time with the research that he had written. He argues that we have a club to clinic gap. If you are here, you will ask, what evidence-based surveillance model can we implement in grassroots sports to ensure the mental health red flags in youth are identified early and effectively referred to primary healthcare providers without overloading the system? That's the referral pathway. So again, I'll engage the audience. Delegates, here is a question for the chat. It's a poll, more of, on a scale of 1 to 10, where 1 is impossible and 10 is seamless. How easy is it for you to refer a student or an athlete to a mental health professional in your community? Give us your number, 1 to 10. Please, we'll want to see the numbers coming up, and that will really help us and inform some of the policies that we have. Ladies and gentlemen, at this point, this brings me to our curriculum of the heart. Shamane Nyokanda, working with the Grassroot Soccer. You people are really doing an amazing work. You are a pioneer of Ubuntu Play. Grassroot Soccer has mastered the art of using football to save a life. Since 2002, your organization has reached over 3.5 million youth across South Africa. And beyond, I was reading your 2024 Mindset Impact Report, and the data is staggering. Sport-based interventions are reducing adolescents' depression symptoms by 20%. Isn't that amazing? Charmaine, you are a titan in the HPSS space. You've seen it all. Grassroots Soccer has mastered the use of sport as a health intervention. How can we integrate Ubuntu-based psychological curricula into academies, into local clubs that we have, into schools, to help adolescents navigate the survivalist pressure of sports and build an identity that exists far beyond their performance on the field? For the interest of time, kindly check on time, and the floor is yours. 10 minutes. Thank you. Welcome, Charmaine.
Thank you so much. Thank you so much for that introduction. Before I fully answer your question, I think it'll be good to just give the audience a quick 2 to 3 minute snippet of our work and our journey. So as I said earlier, Grassroot Soccer was founded in 2002. And at that time, during its founding, Grassroot Soccer has gone from reaching 1,500 youth in Zimbabwe to reaching more than 25 million young people across 60 plus countries. And this started in 2002 with an initial cohort of 14 trained mentors who have become a global network of over 23,000 coaches. And so I'm giving that context because coaches are very central to the work that Grassroots Soccer does. So coaches are the near-peer mentors that Grassroots Soccer recruits who are from the communities where the adolescents live. And these coaches are the ones that deliver our programs, and they become positive role models, providing life-saving skills and knowledge and support and access to vital health services, and helping those young people adhere to positive behavior. I'm starting with our coaches because they are what makes the program a success. For a lot of us, when we think about scale and when we think about expanding program, we immediately think about, how many people can our coaches reach? How many people can our coaches impact? But you're not going to have impact and sustainable scale without taking care of the people that are central to that work. And at Grassroot Soccer, we're very intentional about the well-being of the coaches that deliver our programs, and making sure that they're able to effectively deliver programs. But also tying into the keynote in the beginning from Dr. Pamela, I also want to touch on why the coaches are so important even in our program design. So at Grassroot Soccer, we believe in applying the principle of nothing about us without us. So all of our programs are co-designed with the adolescents that are going to receive the program, the youth who are the coaches that deliver the program, government representatives that make policy in the communities that the programs are going to be delivered in, and community members themselves. And we're very intentional about this, because we even have a youth advisory committee, which is composed of young people that serve as internal advisory and an advocacy board at Grassroots Soccer. And these young people are from the different countries and geographies that we work in. And so they work hand in hand with Grassroots Soccer in designing our programs, in pre-testing our programs, in implementing them, and in evaluating them as well. And so we hold things like design workshops with coaches, community members, and staff to really guide the development of the programs that we deliver in the different geographies that we work. And in addition to those groups of people as well, jumping on to, thinking about Ubuntu and resilience. So when Grassroots Soccer is introducing our programs, so our mental health promotion and prevention program is called Mind Skills. And the key intent of Mind Skills is to teach, is a youth-centered model that equips young people with the knowledge and skills and the agency they need to make healthy choices. And we call that learning the game. And then also connecting them to positive mentors and peers and support systems that respond to their needs. And we call that building a team. And those are the positive mentors, are the coaches, the near-peer mentors, and then support them to take action and practice those healthy behaviors and access services and opportunities they need to thrive. And we call that making a move. And so I've just quickly summarized our Mind Skills program for you in terms of what it aims to achieve. But when we bring our Mind Skills programs to new countries, we also hold contextualization workshops, not only with the young people that I've mentioned at the Youth Advisory Committee, but we also engage government stakeholders, Ministry of Health, Ministry of Education, or Ministry of Primary and Secondary Education in Zimbabwe, as it's called, and key international organizations like WHO. I will give an example for our Mind Skills pilot in Kenya that we piloted in Nairobi and Mombasa that showed a 46% reduction of adolescents with depression symptoms. We partnered on that Mind Skills pilot and our ongoing work with an organization, a local organization in Kenya, LVCT Health, but we also partnered with the Ministry of Education, and we were working hand in hand with the counties as well. And in Zimbabwe, when we had our Mind Skills pilot as well underneath the Special Initiative for Mental Health, the WHO Special Initiative for Mental Health, we did that in partnership with WHO and our local partner in Zimbabwe. And, in things related to things like referral, that enabled us to have our coaches refer young people to MHGAP trained nurses. And then they were able to then refer to the next people. So a big part of our ability to work in communities and continue to ensure that Ubuntu is central to that work, especially in the African geographies that we work in, is our commitment to partnerships. So partnerships is central to Grassroots Soccer's approach. Instead of operating in parallel systems, we work collaboratively with ministries of youth and sports, of education, of health. We work collaboratively with schools, with community-based organizations, and global stakeholders to adopt and integrate our programs to make sure that they're aligned and can be integrated into national and local platforms. And this has also included us being intentional about being in technical working groups in the regions that we work. So in Malawi, we are part of a technical working group there. And at some point when the flooding happened, the government immediately was like, hey, we have people that have been affected by floods in these camps. They need a program. And they called Grassroot Soccer and they're like, can you send your coaches to these camps to come and deliver a program? A few of our coaches went to the camp after the flooding and delivered and adapted mind skills in that setting and helped the government identify young people who couldn't adhere to their art treatment anymore because of the impact of the flood, young people that were close to depression, young people that were experiencing anxiety, right? We are part of technical working groups in Kenya. We have interagency technical working groups thinking around how do you integrate now mind skills and scale it up in the different schools in Kenya. We're doing the same thing in Zimbabwe now, where we're speaking with the Ministry of Primary and Secondary Education and saying, hey, how can we integrate this into schools? How can teachers be coaches as well? And how can we integrate this both in schools and in communities? And really the key thing that I kept thinking about when I received this question is that core design element and having the right people in the room, the key decision makers, the people that are receiving the program, the people that deliver the program, and people that will be impacted by the program, and making sure everybody is represented in the conversation before you then implement that program, right? And we found that has really enabled us to make sure that the young person is at the center, if the young person is at that focal, where they're able to influence the programs that we design, how we use soccer and games, and how to make sure that the culture of our program is continuously learning, fun, and participatory. And lastly, I just wanted to note, we have a lot of conversations about the culture in soccer and football. Interesting to note is that in the 20 plus years that Grassroots Soccer has been delivering programs using sports and soccer, more than 50% of the people that we've reached have been adolescent girls and young women through this sports-based participatory program. We've been reaching them. We have been managing to keep them engaged with how we approach. And this really does go back to that core design and having youth as central to the work, but also bearing in mind that you will not be able to scale sustainably if you don't take care of the people that are delivering the programs. So from the beginning, when you're thinking about mental health and delivering a program to adolescents, you need to think about the coach, the person that's on the ground every day, and you need to make sure that they see in your plan that they are also a priority. And that way you can make sure that your program is both impactful to the people you want to reach, but also still has those core elements of Ubuntu, because Ubuntu is not just about the people being impacted, but also the person leading the charge of that impact. Thank you.
Thank you so much, Charmaine. I don't need to add anything on what you have just said, and the data is just amazing, and how you are doing it. I'm telling you, it's just amazing. It's just a challenge. Now from football, soccer, please now scale up to some other unit of sports, because sports is wide. Because what you've just said, by the way, the safe harbors for our young people are already there. So sometimes if you want to resonate well with the young person, use what they have already loved, and then you'll be able to transform them and change them forever and for good. Thank you, Charmaine, and thank you, Grassroots Soccer. I'll reach out to Elizabeth, and I see how she can be part and parcel of our work, because right now what we are doing on the mind ball, we are using the terminology that young person already love. We are using digital terminology. Every young person today talk about Android. Every young person today talk about operating system, software, mention it. So we leverage and make it as lively as possible. So the spirit of Ubuntu continues. I am because we are, and we are because I am. This is wonderful. So to the audience, please, for the interest of time, I'm seeing time is going, and I believe we'll be able to have some good time to allow you to unmute and also contribute to this important conversation. And the question for the floor, in one word, kindly, in one word, what happens to an African child's identity when they are told they are just an athlete? Type it on the chat. And if you check on the chat, by the way, there is amazing feedback on the chat. Just take time, scroll down on the chat. You will be able to see what is happening on our field. And the sports field it's a sector that's really accommodating millions and millions of young people. And we have a lot who are really struggling, a lot who are really looking for safe space. And if our coaches who are their role model in the community are not equipped with the tools, are we having safe spaces, or are we having that red light or red flag that is yet to explode? You know what I mean? Then if a child is in his red state of mind, then to mean that he really needs quick intervention. And if a coach who really works with this child close and close is not equipped, he may cause harm than good, because he will put a lot of pressure. He will start tagging this child names that is not working hard, is calling him names that is lazy. But this is a child, an innocent child, who is just coming for help, and he only needs some guidance. There is a lot of stigma and self-esteem. And I really love what one of the audience mentioned, that it is high time we need to train our children to lead, but not to nurture. You train to lead. Yes, so leadership, they'll be able now to have skills that they can use to navigate the pressure that they're meeting in their day-to-day life. Please continue writing the question that I've just posed in a word, that what happens to an African child identity when they are told they are just an athlete? Yeah, so thank you so much. I would like to applaud our guests. We have various people who have come from USA. We have India represented. We have Zimbabwe represented. We have Cameroon. We have Nigeria in the house. We have Kenya in the house. We have China in the house. So thank you so much. We really appreciate your time. So that is the mind, ball spirit, Shaman. But to make this real, it has to work in the pitch, and in the heat of a match, it has to be gym bag ready. And that's bring me to a man who lives on the pitch. I can see he's ready. The smile is just amazing. Leo, you are the bridge. You are the bridge, because this is the reality that you are fighting every day in the pitch as a pro athlete and a mental health coach at DBA, or a mental health advocate. Imagine you are playing the greatest role, being supportive to your peers, to your fellow athletes. You carry the legacy of one of the most prestigious high-performance academies in the region. You know the sweat of Kenya Rugby Simbas. You know how Kenyans are really looking up to you with the greatest job that Kenya Rugby is doing today, the pressure and the grit of Shujas. You've seen the 2023 data on the invisible injury in African rugby. You know what the heat are not just physical, they are psychological. Leo, we have this mindful book or handbook in review stage right now, and I'll really be glad to share it with you someday, and very soon, once everything it's done. And also you can also contribute as a practitioner who is in the school, who is in the field, on the grass every day. I want to pose 2 questions we discussed. There are so many questions, but we've tried as much as possible to put them into 2, because you have the real situation at hand. The Ubuntu approach still continue in high contact sports. Rugby is rooted in collective strength. How can we leverage the Ubuntu's approach, shifting from individual survivalist pressure to community or communal resilience, to reduce performance anxiety in young athletes who feel the weight of being their family's financial tickets. And then again, as a mental health coach, how can we equip grassroots coaches? How best can we equip grassroots coaches to break the infrastructure of silence, that is stigma? Specifically, what digital or community-based strategies can be used to monitor the mental well-being of athletes without compromising the discipline required for elite performance? Over to you, Leo. Please enjoy. You are on mute kindly. Okay, there you are.
Can you hear me?
Welcome. Yes, go ahead.
Okay, so thank you very much. My name is Ubuntu-based Leon. I will call myself as an active athlete, but sadly, I have had to retire on medical grounds, like you said, the invisible injuries. Yeah, so kindly repeat the first and the second question.
Oh, technology sometimes I was speaking and only to realize I was on the mute. Okay, so the first question is it's rooted on the Ubuntu approach, and rugby is rooted in a collective strength. How can we leverage the Ubuntu approach, shifting from individual survivalist pressure to communal resilience to reduce performance anxiety in young athletes who feel the weight of being their family's financial ticket?
And the second one?
And the second one is touching on the coach as a communicator model. As a mental health coach, how can we equip grassroots coaches to break the infrastructure of silence? Specifically, what digital or community-based strategies can be used to monitor the mental well-being of athletes without compromising their discipline required for elite performance?
Yeah, okay. Thank you so much, sir. Basically, the first part of the question will basically be dealing with integrating psychosocial well-being in sports, if I get that right. And my journey from professional rugby to coaching and mental health advocacy has exposed me to the reality that many do not like speaking, more so the young athletes. Many do not speak about that passion that they have, because not many won't see the pressure that comes or the expectations that come often from the family side or those who are engaged with the athletes off the pitch. So in many African contexts, sport is seen as a pathway out. Like you've seen my previous speakers say, this creates a survivalist mindset because everyone wants to use sports as a scapegoat, something that is very common in the Kenya rugby fields, because the young boys and girls start off very young and very talented, and they know that once I get this visa or once I get this ticket out, then I can easily open doors of whatever salaries or whatever remunerations we get. That survivalist mindset is where identities are tied down to income and worth. So the question, how do we protect the mind while building the athlete, is what comes off the integrating the social well-being part in sport. So the Ubuntu approach in high context sports for me comes from, I know we all know the philosophy, I am because we are. So I personally believe rugby already reflects Ubuntu structurally, because no single player wins a match. It is a team sport, right? So I am because we are, and we are because I am. Two, every role matters from a prop to a fullback. You know, rugby is played by 15 athletes on the pitch with different strengths and different factors on the pitch. So every role matters, which still lines back to the Ubuntu philosophy. That is, I am because we are. So a prop who is one of the biggest and most powerful players on the pitch needs a winger who is one of the smallest or most agile, because when these two come together, they produce something that propels the team forward, right? And the third would be trust and support always defines performance. So if I don't trust my prop to hold down the scrum, then there's no way the prop is going to trust the winger to finish off or score the try. So these three pillars drives back to rugby already reflecting what the Ubuntu philosophy structurally means. So the problem that comes in play is young athletes feel like the chosen one for their families. Okay, so we have this girl. She's very talented. She's in high school. She's played for the club a couple of times. She's been named the MVP, but now she feels like whatever she gets from the club from the day she's played has to go back to mom or dad because it's a way of giving back, which is structurally wrong. Internalized pressure, that's anxiety, fear of failure, always come in play because I am this good, I can't be able to let down the team. So that's also another thing. Then competing individually within a team environment. So most of the time, our athletes break down within themselves, which drags their performance in the team, then drags down the whole team. I hope I'm clear until that point. What works would be for us to shift from survival to collective resilience. Whatever the coaches can bring about is practical coaching interventions. So the first one would be a shared responsibility culture. So replace star player language, like you said. There are keywords on the negative side that coaches use. There are also keywords on the positive side that coaches need to stop using. So replace star player language with team outcome. Okay. Avoid calling out or singling out top players and try make it a team thing. Example would be a training, rotate leadership roles. So yes, we always have a team captain, but we have warm-ups, we have feedback sessions. So you can always run the captaincy through those sessions and keep exchanging the roles, the leadership roles in those sessions. That way, athletes will feel supported and not isolated, of course. Point two, on the practical coaching interventions, we have story circles. I love this from an amazing coach. His name is Coach Simon Odongo. He uses story circles as a team building thing in the ladies team. So once a week, players sit together and share personal experiences, wins, struggles. And I think the recent most amazing part was Kenya is made up of 40 plus tribes, and he had the girls share the plays in their local dialect, just to prove to them that no matter what way you communicate in, the message is always one, right? So the ground rule of that would be no judgment and no interruptions. And the impact it brings about is it builds empathy and reduces silent pressure. Because if I know my teammate can't communicate to me or can't be open with me, no matter what or no matter who or no matter where, then that is definitely going to reduce that pressure I have of having to communicate something that is bugging or pressing down on me. I hope I'm clear up to that point. The third coaching intervention would be a team-based goal setting. Instead of a you must perform environment, try and shift to what does the team need from each one of us, okay? So a perfect example would let the forwards focus on structure, backs can focus on execution. So we'll always have a way of shared success that the goal setting of the whole program comes from within us. That still aligns to the Ubuntu philosophy. The fourth practical intervention I'd give would be normalize failure as a collective experience. I always use this as a word out to coaches or the students that I coach, that teach yourself to fail so that you can outlast everyone, okay? So post-match reviews, avoid blaming individuals, focus on what did we learn as a unit. So always keen on asking the kids what worked for us, what didn't work for us, and what can we do better as we go into the next month. On ground reality, that is case in sight. In grassroots setups that I've worked with, I've seen kids skip meals. Now at DBA, because DBA we deal with the kids from all around the country, the different setups. Yeah, so I've seen players skip meals but show up to train. I've seen kids hide injuries just to avoid being dropped, you know? Like he has this knock, but the feeling of, I have to do this, he'll hide it. Many do not speak about the stress or anxiety, more so from where they come from. Because you'll find he's left home just to come and grab the snack that we give out at the end of the academy day. But he won't tell you of how he'll have to miss a couple of 3 or 4 meals just to have the third one on maybe Monday or Tuesday. So silence is not strength, it's definitely survival. And that's a message that we have to teach our kids or our grassroots athletes to undo and learn, so that they learn to actually speak up. So this is where Ubuntu becomes practical and not theoretical. So silence is not strength, it's survival. And we need to teach our athletes to learn, to unlearn, just to learn how not to. I hope that makes sense. So the coach as a communicator model. Coaches are often authoritative figures and let's say performance drivers. But rarely are they trained as listeners or mental health gatekeepers. Because I'm always telling guys, most of the coaches we have around at the academies are either guys volunteering and guys, former athletes who are back, or guys who just want to see things go well at the grassroots level with very little to give or offer. So the challenge, infrastructure of silence, the stigma around mental health, fear of appearing weak, lack of safe communication channels. And again, basically, this just comes through. Pardon, can you hear me?
Yes, go ahead, please.
Yeah. So, this, like I was saying, most of our grassroots coaches are not psychologists. They are not therapists. Many are just volunteers, former players, or teachers trying to support teams with limited resources, right? So if we make mental health support too clinical or too complicated, it never reaches the ground. What we need is something practical, for a starting point, I am because we are. Actually, Ubuntu reminds us of the well-being, that well-being is collective. Okay? So, building coaches as communicators. Coaches as a communicator model needs them built towards that direction, from command to connection. Everybody assumes being a coach means you are in charge, which is true, but it also needs you as someone who can connect. So be someone who can actively listen, not just hearing. I always tell guys there's a difference between hearing and actually listening. So you have to be someone who's able to understand what your athletes need. For example, after training, ask how your athletes feel, not just physically, but emotionally. More so when dealing with girls, you don't want to make the session too much about the session, okay? You want to engage their mental aspect of it for them to actually enjoy and understand what the session was about. 2, language awareness, like you said, avoid harmful phrases. Be a man, push it through. That usually comes out tough on the kids. To us, it may make sense because you really need them. Sometimes you do it without knowing. You really need someone to push. But replace such language with, let's understand what's happening, consistency, or pushing through, or tag along, put in high fives, okay? Put in mini games that can actually pump guys through. Consistency in check-ins, make them short and regular so that they are more effective than having one big one that have people zone out, okay? So just be consistent in check-ins, but just don't make it one that can have the players zone out after a given time. Another thing, as communicators, with coaches as communicators needs the digital and community-based strategies. So real-time example would be WhatsApp check-in systems, okay? So like for us at DBA, we have anonymous check-in polls from our academy directors. So he'll always ask how the week is. He'll always ask from a point of view of what is good, what is okay, and what are we struggling with. So the coaches also take up the same. When we have our academy days on Sundays, we follow through privately and ask around with the kids on what is good, what is okay. So with this, early detection makes it easy to handle without public exposure. For example, you find a young girl who is being bullied, not at the academy, maybe in school, but she carries it on to the academy. So you'll find that through these check-in systems, it actually gets easy to highlight such a thing and maybe follow through to help the young girl. Journaling, definitely. I know, Collins, I'm just about to finish. Journaling, definitely. We are always teaching our kids to keep notebooks and journal down what challenged them, what they're proud of, and that encourages self-awareness and makes them able to express themselves emotionally. There's peer support, 3 or 2 trusted peers that we always train on how to spot behavior changes or offer peer support to their fellows, and that's basically it. So when it comes down to communication from the coaches, it also involves the community as a whole. So the parents, former athletes, stakeholders, we always have that time where we invite them to academy so that they can speak and mentor the kids at the academy. Just to finish, social media as a safe space. Social media is a very powerful tool. How you use it determines how you flourish, more so in this world of mental health. So we've tried using the space to share athlete stories, the struggles and wins, so that we normalize the conversation on mental health. So from my experience, relatable content creates connection faster than formal sessions. So when we have stories going around on what has happened to who, then we have more guys coming in to try and share their stories, to actually build off their stories and become better. Otherwise, thank you so much. Sorry, it took a little too long on that.
Thank you so much, Leon. That was wonderful. And even without wasting time for the interest of time, there is one question I was running through the comments, the chats. That is Jerry Okeno, who have asked a question. And okay, Jerry, he has said that he's been watching you as a rugby fan when he played for Queens, and subsequently him being the coach, you being the coach of Queens. How are you pushing for mental health within the sports jurisdiction, starting with your team? I think I've gotten it right, Jerry. Oduor, may you respond to that, please?
Oh, sorry. I didn't know it was that was for me. So thank you very much, Jerry, on highlighting what I've been doing. Your question is on how I'm setting up mental health. Okay, is that the question?
Yeah. So the question is, okay, here is what he's saying. I've watched Leon as a rugby fan when he played for Queen, and subsequently him being the coach of Queens. How is he pushing for mental health within his sports jurisdiction, starting with his team?
Okay, so basically start where you are. The first thing is always start where you are. So with my team, we're always doing the small check-ins. We normalize the conversation on mental health. So we always have our days where we set aside everything, no rugby. We're just sharing and building each other on who we can be off the pitch. Then we've brought in specialists. We have therapists that I specifically talk to the exco, so that we have the girls go talk to specialists, or specialists come in and they can always find time to share under the oath, of course. 2, equip coaches. That we're perfectly doing at DBA. We've had the athlete program that is currently running, and coaches are being trained on how to go about the system of mental health, and how to engage with athletes, and also how to create awareness on that. 3, you can always use performance language, not just health language. So instead of saying mental health is important, you can always frame it as mental strength improves consistency. So always give the guys a proper language in which they can use to, internalize and integrate all that. Then the last bit that I'm very loud on is break the silence publicly. If you follow me, I have this campaign, Mind Fitty Game Fitty. Probably talks about everything you do starts in your mind. So we've been putting a similar hashtag, that Mind Fitty Game Fitty, and we're always sharing. I'm always sharing stories. I'm always sharing what can I say, knowledge on what people go through. I try to relate what I go through, what I went through, to anything that an athlete can be going through that I see. Last but not least, build partnerships. Here I am at YIDP. I just found myself receiving a very amazing email to give this talk. And yes, so that's basically. So always start from where you are and try to build up to partnerships and collaborations. I hope that is answered.
Yeah. Thank you. Thank you so much, Leon. I know time has gone, but please, ladies and gentlemen, we are requesting you to be patient a little bit so that we can wrap up. So that's so powerful, and that brings me to one more of question. Can a coach be taught and supportive at the same time? No, sorry. Can a coach be tough and supportive at the same time? You can type it on the chat. So powerful, like Leon. So we are ready, and you've really given us some great points. We really appreciate that, being able to be in the field and also helping your fellow peers. That's the mandate. Delegates, keep the conversation going. You can do post on your handle. And at this time, I would like to invite delegates. Maybe if you have a question, we'll have 5 minutes at most. Maybe if you can raise your hands, or you can type it on the chat, that will really be helpful. Make it as brief as possible because there is no time, kindly. Do you have anybody? Okay, I can see Surajit raising hands. Please go ahead.
Thank you very much. Thank you very much for the opportunity to speak. My name is Suraj Abdul Wahab. I'm a sports and social entrepreneurs expert in Kaduna, Northern Nigeria. This is an amazing topic, and I'm super glad that YIDP is doing this because I've started as a coach. I played because I understand the pain as a young athlete who want to play, and then at the end of the day, maybe you got injured and then you couldn't play again. That's a huge setback that a lot of young people suffer as an athlete. Or perhaps you spend a lot of money to go for screenings, for trials abroad, and you didn't make it. You come back and then you go through a lot of mental trauma. Or perhaps, the life of an athlete is about you to impressing your coaches. You need to impress your parent that what you're doing is actually right. Because in Africa, 9 out of 10 parents do not even believe sport is actually a career. No, they even tell you that's something you can actually engage in. So you have to impress your parents. You have to impress your coaches. You have to impress the spectator. Our life is all centered around, making sure that you're impressing everyone. And that is a huge thing to look at. So ranging from that to the retirement of a retired athlete who suffer from the is it over? The money is not there, the fame is not there, the power is no more there. the accolade and ovation that people give to me is no more there. Now, all of this centered around why athletes is super important. And I want to say, Charmaine, fantastic job you're doing. And I'm also happy for Ngwe for doing an amazing work, for telling us that, yes, the world is actually seeing the pains of athletes. Now, why am I here? I would like to answer the first question, the question of the last question you asked. Can a coach be actually tough at the same time? So it's quite important to know that there's two sides to a coin. But most of the time, it's not all coaches. The coaches believe the push, the motivation is what brings out the best in athletes. But from us in our own organization, which is called Tewa Sport and Skill Center, Tewa Rockstar Academy, we've come to realize based on experience that you need two sides of a coin. You need to motivate the athletes. You need to understand the mental state of athletes. You need to, talk to them, let them understand their own value, and then let them understand that, their mental capacity is super important. And that's why we have what we call 5-finger fitness. The 5-finger fitness is what spiritual fitness, because for those that believe in spirituality, mental fitness, physical fitness, social fitness, and financial fitness. Now, this fitness that we're talking about, the mental fitness, we work with it seriously. And I love the word mind skills. That's what we do. We do not call it mind skill, but we realize the importance of the engagement of the mind. And then we also realize the physical aspect, which most coaches concentrate on. But the social fitness is also super important to understand that you play in a team. Whether your own family, you always be in a team, in the school, every time, anywhere, you're always going to be in a team. Understanding this management of this team is super important. So, and as such, you'll be able to create a network of people that will help you. So I want to say thank you very much for this opportunity. I don't want to go on and become one of the, just to say that I'm super excited because this is what is happening to us in Africa. The mentality is super important. If, for instance, you take football, we play so much in Africa with a lot of physical energy, but the mental capacity of the West, they used to win us at the end of the day. I had an opportunity to have a chat with a hero, former captain of Real Madrid, and he told me that I asked him, why is it that when we play, eventually the European win? He said, an African player cannot concentrate for 90 minutes. If you promise him something, they start thinking about that money. If they don't get the money they are losing, they start thinking of what they are going to lose in terms of finances. So in my conclusion, I'm sorry to say this. I'm also looking for collaboration. We're also having a program, Sport and Social Entrepreneurship Summit, the 3rd year. We would like people to please come and talk about this, particularly Mr. Collins, please. We're looking forward to seeing you in Nigeria so that you can join us and come and help us to talk to, young people, coaches, stakeholders, that it's super important to work on our mental capacity. Thank you very much.
Thank you so much. Thank you so much. I think at this time, do we have any question? If not, allow us to conclude kindly. If there is question, type it on the chat. We'll be able to share it with the panelists who are here. And I've seen Emmanuel dialing in. Emmanuel, because of time, you'll be able to get chance some other day. So is there any burning question? If there is no, okay. Otieno Omodi, that's gonna be the last question. Make it short and spot on. Go ahead, Otieno Omondi. We can't hear you, kindly. Time?
Sorry about that. Can you hear me right now?
Yes, go ahead.
Yeah, so my name is Otieno Omondi. I'm a clinical psychologist, and I've also specialized in sports psychology. I work with Solid Minds Counseling Clinic. We are based in Rwanda. And just to mention, on the record, I've played against Odur Nyang some time back, and I used to play rugby. And I just wanted to mention that, and also to, recommend him, appreciate what the work that he's doing in terms of mental health. And even here at Solid Minds, I'm looking forward to maybe further our engagement in terms of partnership. So this is a good thing that you're doing, and you guys keep doing what you're doing. Thank you.
Thank you so much. Thank you so much, Otieno. So if you have any question, kindly type it. We'll be able to share it with the speakers so that they respond to them as soon as possible. Okay, so ladies and gentlemen, we have just witnessed a master class in multisectoral collaboration. I want to make a moment to look at the digital scoreboard we've built in the last 50 minutes. I would like to ask our technical team now to share the presentation. We started with Mr. Ngata and the global standard of UNESCO reminding us that sports, a pitch without safeguard is a breach of a child's fundamental right. And we've moved to the regional heartbeat of the ESC, where Elkanah, through his not empty chair, is currently being filled by policymaking in Arusha. We looked at the clinical surveillance model of Dr. Emmanuel, and also bridging the club to clinic gap. We felt the soul of Ubuntu through Shamel, and also we ended with Leon's mandate to keep our tools gym bag ready. So ladies and gentlemen, we have the best policies in Paris, France, the best research in Lagos, Nigeria, and the best rugby drills in Nairobi, Kenya. But if we don't break the infrastructure of silence, we are just spectators of tragedy. We have spent decades training the African champion for the scoreboard. Today, we have started the work of training the African human for a lifetime. As the moderator, I want to reiterate that YIDP is not interested in one-off webinars. Our curative team is taking every word spoken on this panel and injecting into the mindful technical books and already tools that are existing from various partners. We are in the review stage of a curriculum that will turn the survivor into success. We are moving from a culture of grit at any cost, to a culture of resilience through safety. So before our panelists exit the screen, I want everyone to flood the chat at one last time in honor of Mental Health Awareness Month. Type a message of gratitude to those 5 giants who are volunteering their brilliance to save our children's mind. Let us show them the Ubuntu spirit of gratitude on the chat, and also clap your hands. I will want to see some clap on the screen. So panelists, you have been more than speakers. You have been the architect of the new African arena. Thank you so much for your time, your data, and your heart. Delegates, we don't stop the noise. We haven't shared. We will be able to share most of the information on our handles, and also we'll be able to share the report with you as soon as possible. So ladies and gentlemen, let's take a deep breath together. But we are not going to take it like now, because just do it very fast. We are moving because of the interest of time. We have spent the last 100 minutes in a high intensity exchange. We have looked at data, we have challenged policy, we have demonstrated the infrastructure of silence. But as we prepare to close this virtual sanctuary, I want to take the moderator's hat off for a moment and speak to you simply as a fellow guardian of African child. First, I want to pause and applaud every single one of you who joined us last year for our 2025 Sports Wellness Summit. You stayed with us in the virtual space when it was just a seed of an idea. Because of your consistency, that seed has grown into a mindful movement we are discussing today. We are the foundation of this house. So as we look towards the future, towards Roundtable 2 on May 14th, Roundtable 3 on May 21st, in our Grand Continental Summit in November, I must be honest with you. YIDP is powered by the Ubuntu spirit. We are volunteer-led initiative or team. We do not have a massive bank account and we do not have a billionaire donor. But what we do have is people. We have you. We do this because the cost of doing nothing is a generation of broken children, and that is a price we refuse to pay. We are moving from the screen to the ground. In November 2025, we are inviting you to meet us in person for the Continental Summit in Nairobi, Kenya. We want to move from Zoom boxes to heart-to-heart design. But to make this summit a reality and to ensure our Mindball technical book reach every corner of the continent, we need your support. We look for you. We look for knowledge partners to join our curative design team and refine our toolkits. We need logistic partners to help us secure the venue and provide the daily bread for our delegates. We need delegate sponsor. This is the most critical. We want our grassroots coaches, our village teachers, our parents, our struggling school directors to attend for free. We need sponsors to adopt a coach to pay for their travel and their seat so that money is never a barrier to a child safety. So if your organization has the resources, the venue, the food, and the heart to sponsor a group of grassroots heroes, please reach out to us today. Don't wait for the formal proposal. Send us a message in the chat or email us through the contacts provided on the screen. I believe the technical teams are doing that, and you'll be able to also to see the events that we'll be having, the series of the webinars that we'll be having. Let's co-author this together. So Roundtable 2 is coming on May. We will be talking about the architecture of protection and the financing of these dreams. Roundtable 3 follows on May 31st for our Global Youth Exchange. And as we adjourn, remember Mental Health Awareness Month is not just a month on a calendar, it is a commitment in our heart. Go back to your school, your community, and your pitches, and remember Leo's word of today. Remember Leo's contribution. Thank you so much. Thank you for your Ubuntu. This session is I'll see you on the field. Thank you so much. Karibu sana. Enjoy the rest of your evening.
Mchezo ni furaha, mchezo ni dawa. Kimbia na ndoto zako, usichoke wala kuwa